Hi, this is Sean with Spark Hormone Therapy, and this is a video for new patients, and I'm going to go over some of the important things to keep in mind when you're just getting started. When we are starting testosterone replacement therapy, we are typically going to be administering those through injections once or twice weekly. Testosterone cypionate, the ester or the half-life of that medication, it makes sense to do that no less frequently than weekly. The vast majority of our patients are doing that on a bi-weekly injection, so that means 2 injections per week. Depending on what your dose is, you're just going to listen to your provider on that and read the label on the script that was given to you, or that came to the patient portal in the instructions. Now, anytime you have questions, you can always reach out in the patient portal and ask them directly. The best way to access that is to go to sparkhormonetherapy.com/portal. So I have a testosterone cypionate vial. This is a 10 ml vial. Depending, again, how long is this going to last you? Well, it depends on the dose of injections. So a 10 ml vial, if you're taking a whole ml per week, that's going to last you about 10 weeks. So a standard protocol, which is about 120 milligrams a week, it'll last you about 16 weeks or so. So we are going to do dose adjustments along the way to make sure that you're really optimized and you're feeling your best. We need to do labs in about 8 weeks after you get started with injections. With creams, it's going to be a little bit less. Creams are a lot more straightforward, right? If you are going to be applying a daily or a twice daily cream, it's pretty self-explanatory. You just use that little toppy clicker, twist the bottom of that until you get your correct number of clicks, and apply that as the prescription says. So the majority of this video is going to be dedicated to talking about how to administer injections. This little device on here, you should have gotten one of these when you signed up for your membership or when you signed up for your treatment. Now, what a vial topper is, this is a really cool little handy device. It makes it so that back in the old days, kind of the old method is to take a larger needle. It's what we would call a draw needle to draw your medication out. It just takes a little bit longer. So we use this really cool device. It's basically like a port. So one of the important things to remember is that don't take a needle and a syringe and put that through this topper. You want to take the syringe that you have here, and you'll take this out of the package. And the way this vial topper works is it just screws on to this port just like that. It's threaded. It's called a Luer lock syringe, and then you're ready to draw that medication. It takes just a matter of seconds to draw that medication out. And then after you draw your medication out, you'll put the needle on, you'll twist the needle back on, and you'll be ready for your injection. So do have one of these vial toppers if that'll focus up. So that's what you're gonna get in this little pack. The vial topper has a spike in the middle. So once you take that out of the package, make sure that you take that spike and try to get it right in the middle. And I'm gonna take this one off, so that we can look and see exactly what, you can see that hole is right smack dab in the middle. So what can happen if we don't get that spike centered properly? Then what can happen is we'll put a lot of extra undue stress and pressure, and these can break and they can snap off. Other than that, you really should have no issues getting that on there straight. So now I'm gonna put this one back on. You never have to take this off or put it back on. This is a single-use device, which means every time you get a new vial of testosterone, you're gonna wanna get a new vial topper. So now that we have this on the vial, we'll be ready to administer and do our first injection. So now let's say your script says 30 units, which is a pretty standard starting dose. You'll take your syringe and you'll pull that back to about 34, because it doesn't have a needle on there. You'll fill the syringe with air. And now you will push this on. Make sure that you take a little alcohol swab and clean the top of the port of the vial topper. You want to make sure that you sterilize that properly. Now that we have that filled, we will invert it, and now we will push the air in to the vial, because this is vacuum, under vacuum, so you want to make sure that you equalize that. So you push air in so that you can draw out, and then you'll pull that back to 34, right around there. And now you'll allow, there will be some air and some bubbles that come in, so you may need to push that air back into the vial, and just, you can give it a flick too to make sure you get the majority of that out to your dose at 34. Now you'll untwist, and now you'll have your syringe filled with medication. Now you will take your needle. In this case, this is going to be a short 1/2-inch needle. This will be appropriate for a deltoid injection here in the shoulder. It's also appropriate for someone that is a little bit more on the lean side. Also perfectly fine to do a subcutaneous injection in the belly. So now we'll peel open the needle, and we will take that needle, put it on the Luer lock syringe, and twist that on. And now any additional air, you'll just give that a flick until the bubbles rise up, and you should be with that needle now right at about your correct dosing at 30. Now for the vast majority of patients, we are going to be doing a bi-weekly injection. So with that being the case, maybe let's just say it's Monday and Thursday. You're going to want to try to split that week evenly, one every 3.5 days. Or it's not super critical, but just pick 2 days of the week. So Monday, Thursday, Tuesday, Friday, those are very standard days that work well with having to come into the clinic and do lab draws. Because now what I'm going to explain is how it's really important to get what we call the trough or the low point of those levels. So how do we do that? Well, we'll do that the day of your injection, prior to an injection, or the day before. So whatever is most convenient for you to get in here, either methods work really well. So let's say we want to do a blood draw on the morning of our injection. Let's say it's that Tuesday. We are going to hold our injection on that Tuesday until after our blood draw. So that's going to give us a really nice, consistent trough level, as we say. Why do we want to do that? Well, we need to do that across all of our patients so that we understand and we are basically doing an apples to apples comparison. Because, for example, if you would do a blood draw prior to your injection one time, and then you took an injection and then took it a day after, your levels are going to be much higher. So it's going to be difficult for us to make good educated guesses on how do we do dose adjustments. We want to keep things as consistent as possible. So now this is going to be ready. There are many other videos that we have done in the clinic about how to actually administer these injections. My personal preference and our standard of care for the best injection site location is going to be that vent glute injection site. It's fine to do these deltoids with these short needles. You can do what we call the vastus lateralis in the thigh. Not a big fan of that because there's a lot more vasculature and nerves as well. So sometimes you hit a nerve, you're going to be very unhappy. We like the vent glute because it's the most convenient. You can reach it. The dorsal glute way around back, like where you've seen most people in doctor's offices, probably that's where they administer it. But for a self-administered testosterone injection or an intramuscular injection, we prefer to do that in the vent glute site. As far as one other thing that I will mention, with this vial topper, if you are going to be traveling with this, it's not best to travel with it on its side or if it turns over, because then you may leak medication out. So always try to keep this medication in an upright position. How should you store it? Cool, dark place. Does not need to be refrigerated. Actually, if you try to refrigerate the medication, it kind of makes it thicker and it will be harder to administer your injections. Sometimes you can even roll this vial in your palm or run it under warm water, and that actually thins it out a little bit and it will make it a little bit easier to inject. As far as how do you inject to, just slow, consistent pressure. You don't need to force it in, because then you will end up taking this syringe and this needle and shaking it around, and that can contribute to what we call post-injection pain and can also lead to more soreness at the injection site. So if you have any soreness or redness post-injection, it's probably not that big of a deal. If you have any red streaking multiple days after that injection, that's something more to be concerned about, and you should contact the clinic and discuss that with your provider. Let's talk about requesting refills. That's also something obviously you're going to have to do when you're on long-term testosterone replacement care. We don't do any kind of automatic refill, so medication is not going to automatically be reshipped to you. You have to request your refills, and there's a couple of different ways to do that. If there have been no dose adjustments and you just need a refill at your same dose, you can again hit that refill request button in your portal. If you want to discuss dose adjustments or you need to have a conversation with your provider, you should call the clinic, text us, or send a message in the portal saying, I'm not sure what I need to do with my dosing. But if everything is consistent, you can absolutely click a refill request. There's also things that you can do. You can schedule a blood draw. You can schedule a follow-up with your provider in the portal as well. So again, sparkhormonetherapy.com/portal is the best way to do that. So please let me know if there are any questions that you have. I hope this video has been helpful, makes things a little bit more straightforward. I know this process can be a little overwhelming. If you haven't yet done your first injection or first couple of injections, just stick with it. Really, the first couple are the most difficult, but once you do it, it's like riding a bike, and it'll be no problem at all. Also, if you continue to have any kind of injection hesitancy or anxiety associated with administering your injections, we have an auto injector product that you can purchase from us as well. We sell them all over the world. It has helped tens of thousands of people, and you can find that at autoinjector.co. Thank you very much for your time, and we'll talk to you soon.